Today we have Dr. Chang Shuk-Kwan of the Head of Communicable Disease Branch of Center for Health Protection, and Dr. Lau Ka-hin from Hospital Authority. Dr. Chang will report on today's cases. Last night we confirmed 26 cases. Case number 10669 to 10694. 10694. What? Pardon me. "16 males, 10 female, 5 months to 75 years old. Of these 26 cases, 5 of which are imported cases, including a foreign domestic helper from Indonesia arriving on the 7th of February, and 4 arriving from India, and detected by the 12th day sample transit via Dubai. These 4 are family members. 19 cases are local transmitted cases, 5 of which are untraceable sources. The other 14 cases are linked to earlier cases. Of the 5 untraceable cases, which included 1 from Whaley building from a flat not of a number 04, as we already evacuated residents from unit 04. In 1 case without an address, and 3 others live in Laguna Verde Phase 1 Block 1, and also in Yunlong Nampin Way Lane 1 Number 1. And 1 from the a resident at the Polang Cook On-Thai Rehabilitation Center had a fever on the 8th of February and diagnosed at the A&E department. There were over 40 residents and over 30 staff on the same floor were sent to quarantine last night. We also know that 2 staff were preliminarily confirmed, 1 of which have a sore throat on the 6th of February. The last working day was also 6th of February. The other was asymptomatic. These 2 staff received regular testing. The last testing date for 1 was negative on the 2nd February, and the other was tested negative on the 31st of January. We found the asymptomatic case was linked to an earlier case, and that earlier case had visited that case as they are family members. That case was a 80-year-old elderly. When we asked for information from that case, and the other family member answered on that case behalf, and that family member, upon another round of questioning, the case finally recalled that the newer case had visited that confirmed case, and the entire family was confirmed. However, they wasn't aware that they need to tell us about this. Upon tracing, we found that this is a linked case. Once again, I would like to remind the members of the public, whether for cases or their family members, the information you provide is very important in contact tracing. I know that for some cases they may be nervous when they first admit to the hospital on their way to the hospital and need to take care of a lot of things. Thus, they may not recall every detail in the past 10 or 20 days prior. And some may recall later, or some may look at the diary and look at the photographs and ask their family members and try to remember who they had interacted with and other kind of events. I hope that they can tell us as much as possible. And some of the cases finally reached out to us and tell us who visited me or who do I had meals with. This is very important in fighting the epidemic. And that's the end of today's report. Dr. Lau will report on today's HA's cases. Good afternoon. As of today, 9 a.m. in the past 24 hours, the HA had reported a total of 32 cases. A 82-year-old female patient with chronic condition, case number 6887, and on the December the 5th, she was confirmed with COVID-19 and checked into the Princess of Wales Hospital for isolation treatment. After treatment, her antigen test returned negative, and her isolation order was removed later. And on the 12th of April, she was transferred to Chatham Hospital for further treatment. And on the 31st of January, due to shortness of breath, she was transferred back to Princess of Wales and continued to deteriorate. And finally, at around 6:05 p.m., she passed away due to her own existing condition last night. We are saddened by her passing and will provide appropriate assistance to her family. Altogether, there are 881 COVID-19 patients passed away in public hospitals. In the past 24 hours, another 58 patients were recovered and discharged. A total of 976 patients recovered and discharged. At today 9 a.m., we have 474 patients scattered across 24 public hospitals and Asia World Expo Community Treatment Facility. 24 are in a critical condition, 23 in a serious condition, 427 persons in a stable condition. We have 1,233 beds, utilization at 56%. Negative pressure wards stand at 674, utilization at 69%. I would like to report on a case of COVID patient at United Christian Hospital. A 27-year-old male patient on the 8th of February, yesterday, was admitted to the A&E department of the UCH due to fever. While testing for COVID-19, that he was shown to be preliminarily positive and confirmed later. He was then transferred to isolation ward and now in a stable condition. The infection control team had started conducting contact tracing. No patients is classified as a close contact. One nurse helped this patient to take the nasal swab and to not wear a face shield. Thus, it was classified as a close contact and will be put under quarantine medical observation. Once again, we'd like to remind our colleagues, while conducting any high-risk treatment procedures, they should always wear a full PPE. The hospital AED have conducted a thorough disinfection. I'd like to add something. The buildings I mentioned, besides the unlinked cases, some of the buildings with linked cases but not included in the previous compulsory testing notices, which include a Sheng Heng House of Upper Ngau Tau Kok Estate, Mei Ying House of Shek Kim Mei Estate, and Yanchi House of Tin Yan Estate of Tin Shui Wai. Today, we have around 20 preliminary cases so far. And now, open the questions. Please put up your hand and speak through the microphone and state the media you represent.
The lady on the third row. Thank you. Now, TV. I'd like to ask about the rehabilitation center in Kwun Tong. Had there been any staff who have been infected regarding the resident who was infected? Did he have any contact with residents? And if people pay visit to that, center, do they need to be tested? So would there, and also would there be an outbreak in the school? This morning, the CE said that after the Chinese New Year, if things stabilize, there is a chance that we can resume full class teaching. Recently, the number of cases have dropped down to 2 digits. So is the situation now under control? Do you think that there's a big likelihood that the social distancing measures can be relaxed. The resident at that rehab center has been confirmed. There are 2 other staff who have been preliminarily confirmed. We believe that these are related or linked cases. As I said, one of the staff was linked to an earlier case. For that resident, he need to be fed by the staff of the center and had to do a lot of physiotherapy, but he still was able to walk around at the home, and therefore all the other residents in that particular rehab center are close contacts together with the staff who attended to him. So far, we do not have any preliminary confirmed cases in respect of the Shao Kei Wan Government Secondary School. Regarding Sinovac, the government is paying attention. Other than the cases, of course, there are other considerations. The lady at the far end, Apple Daily. A question regarding the residential care home. Regarding the staff who was asymptomatic, he is linked to an earlier confirmed case. Regarding the 80-year-old patient, what is his case number, and when was his onset of the infection, and how many days before onset did they meet, and what transpired? Did they meet and did they not wear masks while they were meeting? For this asymptomatic, staff, how long had been the incubation period? You also refer to, another untraceable case for which you don't have any address. Is the homeless person? Why is it that we don't have the address for that person? For that earlier case, the patient had a cough, started to have a cough on the 29th of January. His whole family, all members of the family have been confirmed positive. He was confirmed at the quarantine center, but the onset of disease was earlier. So on the 29th of January, he had a cough, but after he was confirmed, we asked questions of him, and the staff of that residential home actually went to his house for a visit, and they're actually family members. So while they were, gathering, they would not have been wearing masks throughout that time. Yes, that's right. Sorry, the lady is not speaking in the microphone. I think he was at the King George V, park, or in the vicinity of Tung Chau Street and Nam Chong Street. He was not able to provide a lot of preliminary information, but I understand that there is a preliminary positive case who is a friend of his, and they are related. And we'll see how we can follow up further on this case. All right, the lady to the front. Hong Kong 01. Just now, regarding the residential care home, 2 staff members and 1 resident have been confirmed positive. We are now approaching Chinese New Year. We understand that if we all want to meet our family members. You are suggesting that there shouldn't be so many meetings. So would you recommend people to take a test if they have paid visits within so many days, for example? Regarding the homeless person, I think in some people there have been lockdowns, and the residents have to be tested. Are you worried that there will be further outbreaks when the homeless person go and pick up the meals? Right? Would there be any risk of infection? And what is the situation in respect of the other homeless persons? Now, when people visit the sick, would you recommend that we should set a limit on the number of visitors? I understand that during Chinese New Year, it is inevitable that we would have meetings and gatherings. Of course, it would depend on the situation, especially for the elderly and the frail and weak. The relative should really consider whether or not you really need to have a face-to-face meeting, or even if they meet, they should cut down on the time that they meet and avoid, coming into close contact while having meals and so on. And also, they should all wear masks. Regarding hospital visits, and also you ask about the homeless persons. I understand that there have been 1 or 2 such cases recently, and they have gone to the community testing center to seek medical attention. For these 2 persons, they actually attended the A&G ward for treatment. We have the social welfare department staff would find ways to remind them to take the test, and for people who live in the vicinity that they should also take a test. Under the emergency, response situation, all public hospitals are now banning visits. But for those who are patients who are critically ill or very young patients, we do have arrangements for compassionate visit. The hospital authority is recommending that family members who pay visit to hospitals should, first of all, have a test, and they should show proof of their being tested negative. For family members who need to pay regular visits to patients who have, for example, emotional problems, then they should take a COVID-19 test every week. Under special circumstances, if the situation of the patient deteriorates very rapidly, of the family members, come to visit on an emergency basis, then after the visit, they should take a COVID-19 test and inform our staff at the hospital ward about the test result. And during the visit, we hope that all family members will comply with all the rules governing hospital visits. They must always put on a mask, and they should not eat or have close contact with the patient in order to minimize the possibility of infection in the hospital. This is to protect our patients and our staff and to minimize the risk of infection. We can now take an English question. The lady on the 3rd row.
From the South China Morning Post. First, I would like to confirm a few more details about the homeless person who was confirmed positive. Where does he stay around, and is there any contact tracing among other people who are in that area? And also, are there any cases today from the Kai Tak construction site, since it was mentioned yesterday that a preliminary case was found there? And also about the number of cases right now, since they are still stabilizing, are you fearing of a rebound after Chinese New Year, given that the lockdowns will be suspended in the next few days, and also because of the crowds of people that are going to different types of flower markets right now? As well as for the schools, school heads continue to say that they are against getting tested, their teachers to get tested. Why is it so difficult to get a consensus for students to get back to the face-to-face classes?
You mean the homeless people, right? We are still investigating whether he has any close contacts. Yeah, and also for the school, we don't have any suspected case at the moment. I mean the Saogewan Government Secondary School, and for the coming holiday, we are worried whether the social interaction during festivals may cause a rebound. That for the public, during this festival, please maintain infection control measures, wear your mask and wash your hands, and minimize social activities, especially those you have to remove your mask. And I understand the Education Bureau will discuss with the relevant stakeholders to see what is the suitable arrangement.
嗰啲冇源頭個案啦，嗰啲冇
So one is an unemployed and a housewife, and the other one is also unemployed and one is the resident of the residential care home for the disabled. I think that's all. Yeah.
我答埋呢邊嘅英文。
Let's take another English question.
RTHK. Dr. Chuan, did the staff member in the care home record he had actually visited a family member who later tested positive for the virus? And also, does the CHP believe that this staff member brought the virus to the care home? And also, secondly, about a case is found in Wiley building today. Do you think the virus is spreading to other flats other than those in 04 flats? Thank you.
We only understand that the staff, because she's asymptomatic, and she did visit the case of a confirmed home. Her relative who is a confirmed case during the communicable period of the case. So it is possible that she acquired the infection from her, but as she is asymptomatic, so it's difficult to say when she carried virus. And also there are two linked cases to her. One is other staff and the other one is a resident. So preliminary, we consider there's epidemiological link between these cases. So for the Wiley cases, I forgot which unit. I understand is in the immediate neighbor of one of the confirmed case. So they share the same entrance, and then they enter their unit separately. So it's very possible they have some unknown contact. At the door, or some. They share the entrance. So essentially, they are quite close to each other. But I understand all the residents in that building has been tested. So hopefully, all the cases have been identified at this moment. Of course, there's still incubation period, so we have to still observe.
下一位。
Next. In the last row, the lady in denim. Mingpao Daily News. The staff at the rehabilitation center who visited a confirmed family member. When was the family member confirmed? After confirmation, the staff case was aware that she was exposed to a confirmed patient. If she was aware of that, what step had that case taken? You claim that she was tested negative in the regular testing. When was that? Do you suspect that it was this staff who brought the virus into the rehabilitation center? A second question on the homeless person. Is this the first homeless person's case? How do you assess the transmission risk? For his friend who is a preliminary case, is that case also a homeless person? What kind of contact do they have? Did they take their sampling at the community testing centers, or how were they diagnosed? Have they checked into any homeless person hostels? And there were a few cases involving homeless person, and what is the total and what is the distribution? Are they linked to each other? Will the government provide support to them? And finally, for the Wiley building, for today's case, is he lived in the subdivided unit next to the case, or what is the relationship with the 04 unit? As you have identified 3 news cases later, and how do you manage to identify the latest case? Let me take the question on Wiley building first. That case, pardon me, that Wiley building case is a preliminary case. I couldn't mix it with others. The 3 early cases were all confirmed, and now we have 1 preliminary case from Wiley building. Let me check. I had it mixed up. The 3 preliminary cases from Wiley building are now confirmed. Currently, we have 1 preliminary case that yet to be confirmed. That case, the 2 cases have taken as samples on the day after the lockdown at around 10 in the morning, which come from Unit 05, which is quite close to the Unit 04 as they enter the same gate. Thus, they may have some contact or due to environmental contamination and become preliminary positive. These 2 live in the same unit. These 2 are yet to be confirmed. The confirmed case at Wiley building were the preliminary cases we mentioned yesterday. We noticed there were 2 homeless person cases, and 1 from yesterday and 1 today. And there was 1 who did provide an address. As we said, there was 1 case claimed to have stayed in the Yunlong Jockey Club Plaza for 2 to 3 days and been loitering on the street. I wonder if you can call this a homeless person. For this, the FHB have liaised with SWD in considering what kind of follow-up, for example, promoting or tell them to see a doctor when they feel unwell or get tested. The latest preliminary case and the inland cases probably shared a meal at the unit instead of using other facilities. Of course, we need to check more carefully. Do you have ask a question on the rehab center residents? The staff at the rehabilitation center was asymptomatic, but did get a specimen kit from the temporary testing center, as the case was aware that her family member was confirmed. We'll usually ask the confirmed cases to tell their close contact to get tested. That case told us that he visited a home of a confirmed case on the 30th of January. We asked her why we wasn't made aware of this in the first interview, and I have just laid down the whole situation. Speak another mic. Speak another mic. Let me check. That case checked into Kwong Wah for a sore throat on the 7th and left their sample on the same day. Speak another mic. That's what we get so far. I need to check for more details.
最後嗰行唔該你先。
醫生你好，經濟部嘅，首先想 clarify 翻今日個本地確診嘅個案係幾多宗咧？因為26+5輸入應該係21宗本地，頭先你講19宗。另外想問翻保良局嗰個院友嘅 case number 同埋露宿者嘅 case number 啦。保良局嗰個院友咧，嗰個院舍有冇話啲院友可唔可以出街啦？同埋有冇人探訪過啦？另外想問埋尋日嗰個啟德停機坪有個地盤嘅管工確診，今日嗰個停機坪有冇多啲嘅工友確診呢？同埋都想問翻嗰個惠理大廈。
At that apron, and regarding the Wiley Center, can you give us a number of the confirmed cases and the preliminary confirmed cases? I'm sorry, I sort of mixed up the number earlier. There should have been that we should have 21 local cases. 2 found at the O4 unit at the Wiley building. If you deduct these 2 cases, you have 19 cases. 5 are untraceable. 2 linked to the O4 unit at Wiley building, and 14 linked to some earlier cases. Regarding the Wiley building, we have 4 units with confirmed cases in Wiley building. Total number of confirmed cases is 7. We also have another unit with a preliminary confirmed case involving 2 preliminary confirmed cases found at unit 05. So we have 3 units, all O4 units, 3 confirmed cases. All the other O4 units, the residents have already been evacuated. Sorry, speaker's not coming through. The resident in this residence center had not gone out of the center or received any visitors. As to whether or not all the residents have not gone out of the center or received visitors, we need to confirm that. We don't have any preliminary confirmed cases. AM 7:30. Regarding the homeless person, does he live in the KG5, park, Hong Kong side or Kowloon? Other than, having meals with the family and friends, are there any further information you can tell us about this person? Could you also give us his case number and also the case number of that resident? Dr. Chung said earlier, that there was a gathering of around 20 people, and many people have now been confirmed. And for these cases and the families, there should have been more than 10 persons, but we haven't seen any clusters yet. Is it that we have clusters of gathering of people of more than 20 people? And for the close contacts who live with the family members, have you found any cases amongst them? 106683, he lives in the Kowloon KG5 garden. The resident is 10692. His gathering, we will not regard his gatherings with family members and friends as a cluster, because it was just private, gatherings with family members, and therefore we would not list out a cluster of the family members who had that gathering. What was the last question? we don't have any such confirmed cases yet. For example, you may, companies or construction work sites or restaurants, and gatherings like that, or you have family gatherings among family members or large number of friends. We would not, particularly categorize them as a cluster, and it's because it's not very useful information for the public. May War staycation. Did we put that onto our website? Sorry. Do we have any further questions? Anyone who has yet to ask a question, we can allow for one more supplementary question. Dr. Chung, regarding the Wiley building, I think the numbers are a little bit mixed up. You told us that there were 3 preliminary confirmed cases which are now confirmed today. You say there have only been 2 cases involving Unit 04. Could you further elaborate on the situation regarding that building? And regarding the family members of the staff of that rehab center, when was he confirmed positive? For the Wiley building, well, yesterday, during the lockdown, we found 3 preliminary confirmed cases, 2 of which have now been confirmed today. 2 live in the 04 unit, so we believe that they are related to the 04 unit, and therefore the 2 persons live in the 02 unit are linked cases. The other case does not live in 04 unit. He was preliminarily confirmed yesterday and confirmed today. But we have another case that is after the lockdown. We're able to, find 2 more persons who hadn't yet taken the test, and they live in the 05 unit, which is adjacent to the other unit. And these 2 are preliminary confirmed cases yet to be confirmed. Regarding the staff of that Center for the Disabled, he is a preliminary confirmed case, and therefore we don't have a case number yet. As to when his family members was confirmed, his family member were the cases announced on February the 8th. They should have been confirmed on the 7th of February. I'm talking about the person he had direct contact with, but he had other family members who have now been confirmed, and that was earlier. Thank you very much.